Okay, so taking a look at our daily cases in Ontario, we can see that the trend we are seeing last week is continuing, where cases are trending downwards, but the decline isn't as steep as the incline was. So it's going to take longer for us to get out of this than it did, unfortunately, to get into it. I think a big part of that story is here, where we can see that the orange lines here are cases that are variants. The blue part of the line is the cases that are the non-variants. And you can see that almost all cases in the province now are pretty much the variants, which is, of course, very different than where we were a few months ago. And we know those variants spread more easily. And because they spread more easily, it's more difficult to control them and bring them down, particularly now that they are in such high numbers. Another way to look at this is to take a look at the reproductive number. And so the reproductive number is basically saying for every case, how many cases are going to result from that one. So how many people will each case spread the infection towards. If you're spreading to one person, you're going to stay with the same number of cases over time. If each case is spreading to more than one, you're going to see growing numbers of cases over time. If you're spreading to fewer than one person on average, that means that your cases are going to decline over time, and eventually you'll be able to wipe out the epidemic or outbreak. And so this is that magical line of one. And you can see if you go back in December and January, that number was above one, which is why cases were rising. We went into a shutdown in late December. That brought that reproductive number quite low, which is why cases were able to come down. You can see here that in mid-February, when the province reopened, that allowed the reproductive number to go back up and stay up. And that's why, was reflected in the number of cases in the province going up. And then with the latest stay-at-home order, that has come back down. But I think a notable part here is that we've sort of settled in, at this level, which is around a 0.9, whereas we were closer to maybe 0.7 back in the second lockdown. And so you can see that this lockdown is not as effective at suppressing the growth or the suppressing cases the way that the second lockdown was. And I think that's again because of the variants. The variants mean that going into a shutdown the way we did in the second lockdown isn't as effective as it was back then. The good news is it is still effective. We are managing to bring cases down, but it's not as effective. And that's why we're seeing that decline I'm showing you is not as steep as it was. And so it is going to take us a longer period of time to see cases come down sufficiently, I think. This is a bit of a, the trend that the Ontario Science Table puts out that they see across the province. And so this is the number of public health units. There's 34 public health units. And so you can see how many public health units have a reproductive number above one versus below one. And you can see that, going into the second wave, we had most health units were above one. Even in this third wave, almost all of them had reached to being above one. That's actually come down, but there's a handful of health units that unfortunately remain above one. I think this is a little bit variable, so we're probably seeing some health units are above one for a few days and then pop below, because you never seem to get all of them to be below one. But that does mean that not all parts of the province, I think, have necessarily been able to suppress cases completely. Fortunately, looking here at the trend in Niagara, we can see that this is the 1.0 level, so we have managed to stay below one. And again, comparing where we are versus where we were during the second lockdown, you can see that the number isn't as low. The reproductive number hasn't gone as much below one. We're at about 0.9, whereas we were actually closer to 0.7, I think, in this second shutdown. And so again, it's not as effective, probably because they're variants. So our shutdowns aren't as effective. And so it's going to take longer to actually bring cases down as a result. So, given that the reproductive number was below one in Niagara, looking at our daily case counts in Niagara, you can see we are definitely coming down. And fortunately, we do seem to be coming down a little bit more quickly than the province as a whole. We're almost halfway back down at this point. So that's certainly some good news. But we, of course, need to stick this out for a few more weeks before we can get down to a really low level where hopefully we will be able to contain it at that level. Taking a look at what the variant cases look like here, we're formally calculating based on the previous week that we have about 63% of our cases are variants, but I actually do think this is undercount. I think there is still a reporting delay by the province, even if we go back looking no later than May 3rd. And some of these later dates are actually still the ones where we're going to still receive more results showing that some of these cases were variants. Now, if I'm looking at this number, if you go back a week ago, this number was 2127. So we've had a little over 700 new variant cases of the B117 variant alone detected in that last week. In this last week, we've actually had 650 new cases. If you're looking at that previous week where we're actually reporting variants, it's about 800 cases. So you can kind of get a sense that actually the vast majority of our cases at this point are variants, unfortunately. A couple other things I think that are notable here is, of course, we weren't reporting the B1617 variant last week. We have now learned that there is one of those cases here. This is actually a case from back in March, so it's quite a ways back. It was a travel-related case. And then this screening result, which indicates it's either the P1 variant or the B1351 variant, this number was actually 45 last week. And you can see it's jumped all the way up to 70. So that's a pretty big increase. We are definitely seeing the P1 variant is growing across the province. So I am concerned that we have more of the P1 variant circulating in Niagara, which I think I've talked about in past weeks as well. And my concern is particularly with that P1 variant is that in addition to spreading more easily, it is also more severe. And that's definitely something we do not want to see continue to grow. Hopefully, as we're able to bring cases down, we will hopefully suppress any sort of spread of this variant so we don't see it resulting in large numbers. So I've talked in past weeks that this is the modeling of where the Ontario Science Table said things were going to go, and they felt that we were probably on this yellow trajectory of cases. If I'm actually looking at what the Ontario case counts are, we're just under 3,000 this week, so we are around here. So we're fortunately actually not doing as bad as the Science Table would model, but we're not quite at this level of the green line. We're somewhere in between of where we're trending. And we have the stay-at-home order expiring on May 20th, so coming up end of this week or this weekend. And what the Science Table shows their modeling is that when you lift that stay-at-home order, cases are going to rebound no matter what scenario you're in. And the higher cases are, the higher they're able to rebound. And so in this yellow scenario, cases rebound right back to being above the worst of the third wave. Given that we're somewhere between the yellow and green, I would imagine maybe we would rebound to somewhere where we're over 3,000, maybe 3,500 cases a day, which is going to be actually fairly high, pretty similar to the, a little over 4,000, which is where we peaked during the third wave. And of course, what they modeled that this meant for ICU admissions was that, we would slowly start to see our ICUs start to clear up. If we're somewhere between the yellow and green, we're going to probably be somewhere in the middle there. And the province had previously designated 150 people in ICU from COVID-19 was a danger level. We're, of course, right now up close to 900. So even if we've come down, optimistically, even to maybe 600 people by the end of the month, that's still extremely high. That's higher than we were between the first and the second wave. And so I do think that we do need to stay in a stay-at-home order for a significantly longer time so we can continue to let this number come down. We can clear people out of the ICUs, get our hospitals some relief, allow people to restart doing surgeries for cancer and some of those other important health issues. Just showing quickly what the trend for hospitalizations has looked like in the province. Fortunately, we are seeing hospitalizations are coming down. In ICUs, it's not really coming down quite so much. It's more flattened out with maybe the start of a slow decrease. And so, I think that's consistent with what the Science Table modeling just showed, that the number of people in ICU would come down much more slowly. And we do need to have an extended stay-at-home order, unfortunately, to hopefully see that come down. In Niagara, we're fortunately similarly seeing that our hospitalizations have come down a little bit. And in ICU, the total number of people in the ICU remains fairly flat at this time. So Just want to remind people here that this is a provincial trend that of what we're seeing in terms of deaths. And unfortunately, we have definitely seen more deaths during this third wave. And of course, that's ultimately why we're trying to control COVID-19, because if our hospitals are overwhelmed, that likely means people are going to be unfortunately dying. And that's absolutely what we've seen. The good news, of course, is that as bad as this third wave has been, and as much as it has stretched our hospitals more than ever before, we fortunately didn't see as many deaths as we did in the second wave. And I think that is really a testament to our success that before this third wave happened, we were able to vaccinate those people at greatest risk of dying. So we've not had as many people die from COVID-19. But of course, we have not vaccinated everybody. And a lot of people who are at lower risk of dying, but nonetheless at risk of dying, unfortunately have passed away during this third wave. And that's absolutely why I think it's so important we get cases very low again, so we don't see people dying from COVID-19 and we're able to reopen in a fashion where we're able to keep cases controlled. We don't see people unnecessarily dying in our society. So, moving on to the story of vaccination, it's of course the people eldest who are most at risk of dying from COVID-19, and we can see that we have very high numbers of people vaccinated in those high stage groups. 96, 97% in our top two age cohorts here of the 75 and above and the 80 and above. The 70 to 74 age group, we're up to 87%, and we actually have people booked up that's going to get us above the 90% threshold. So, people 70-year-olds and up are definitely signing up for vaccine, and we're getting very high saturation of the number of people vaccinated in that group. The 60 to 69-year age group, we're now up to about 3/4 of them vaccinated, and we actually have bookings that will get them into the low 80% range. I think it's about 83 or 84%. So that's really good news as well. And hopefully, like some of these other age groups, we'll be able to continue chipping away at them and get them higher and higher. The age groups where we're most focused right now is, of course, the 50 to 54 and 55 to 59 age groups, because these are the age groups where vaccination has opened up most recently. Seen quite a good turnout. We're now above half of the 50 to 59-year age group. And I think when we look at bookings in place, this actually goes up over 70%. And the 50 to 54-year age group, while only about 36% are vaccinated, that becomes, I think, close to 56% when we start to look at all of the bookings in place. So that's very good news, but that still means that we have a good 30, 40% of people in these two age groups who have yet to book an appointment. So one of our priorities is to really do some targeted messaging to these age groups to make sure we encourage them to sign up for their opportunity to get vaccinated so they can start to look similar to some of these other age groups. I know with the 60 to 69 age group, we did see that uptake was a little bit slow to get those bookings, but as we've continued to press the message on them, more and more we've gotten people getting vaccinated and gotten people booked in for vaccinations, and we're hopeful that we'll be able to achieve that same kind of success with the 50-year-olds. Later this week, we are going to see the 40 to 49-year age group open up for vaccination, and we actually have a pretty good head start. We're almost 32% of these individuals are already vaccinated, and hopefully as appointments booked for them, we'll start to be able to get to see those groups rising again. So this week, as I mentioned, it'll be the 40 and up age group who opens for vaccination. Tomorrow, actually, we're going to have the essential workers who can't work from home in that second group actually become eligible for a booking through the Ontario system. And then other people with at-risk health conditions will likewise open with the 40 to 40 plus later this week, likely on Thursday, I'm thinking. And then, of course, next week, the age group drops to the 30 and above, and then the week after that to the 18 and above. And I imagine at some point after that, we'll be vaccinating the 12 to 17-year-olds without too much delay. So as we get more and more vaccinations in people, it'll hopefully be coinciding with us bringing cases down. So we'll have the benefit of reopening with cases low at a level that hopefully contact tracing can keep it contained, with a big assist from actually a large proportion of the population also being vaccinated by that point. And I just want to end here with just commenting on a couple of other parts of the world where they've done vaccinations already. And so this is, a few countries that around the world that have done vaccinations. This is us here in Canada, and you can see that we've really picked up our vaccinations in Canada of late, and we're starting to catch up with some of these countries that have had a quicker rollout than us, which is great. I really want to focus on these 5 countries here, which have really been some of the leaders in terms of vaccinations. Seychelles, Israel, UK, US, and Chile. And how have they done in terms of cases of COVID-19, despite them, having real success in getting a large proportion of their population vaccinated? And what you'll see is actually they've had a pretty mixed record in terms of their cases. So, if I just go back here, Seychelles here was actually the #1 country in terms of having vaccination penetration in their society. And they are actually doing the worst in terms of having cases really surge in their society. And the big lesson I think I take away from that is that relying on vaccination alone to control COVID is probably not something that's going to happen, at least in the near term. Maybe once we get vaccination rates really high into the 80s, 90%, maybe then we'll have enough people vaccinated. But prior to that, we probably don't have close to herd immunity that's going to on its own contain COVID-19 cases. In Seychelles, what they did is they actually reopened their country to tourists. And when reopening the country to tourists, they actually saw a surge of cases, despite the fact that they had, pretty high vaccination penetration. Chile is another country, if, just popping back here, doing pretty well with vaccination. And they're a country that has opened up and they saw a surge of cases. And unfortunately, they've had to use a lockdown now to bring their cases down. And I think the US is a bit of a similar story as well. We all know how the US has not been the most aggressive in trying to control COVID cases. And so their cases have remained pretty high, even though they've been very successful with vaccination. The flip side here is the UK and Israel, which both in the latter part of 2020 saw variants spiraling out of control in their societies and actually went into quite intense lockdowns. The United Kingdom actually did a 4-month lockdown. 3 months in, they reopened schools, and it wasn't until April 12th that they started to reopen the rest of society. Israel likewise had a pretty intense lockdown in about early March that they started to reopen. And the key thing you can see here is if you're looking at Israel, they brought their cases really low in kind of the early part of March before they reopened. The UK brought cases pretty low. It was actually not too bad by the time of early March, but they actually kept going until April. And the benefit they saw is that once they were able to reopen then with cases really low, their high vaccination rate is allowed so far for those cases to remain really low and remain flat. And I think the lesson here is, do we want to copy the lessons of places like the Seychelles and Chile, or do we do what the UK and Israel do? And I would very much argue we should do what the UK and Israel do. Drive our cases really low so that when we reopen, we can actually do so safely. We'll have the vaccine really helping us, and we'll actually be able to make a much more confident return to normal. Whereas if we reopen too early, if we don't extend the stay-at-home order that's expiring later this week, I think we could well be seeing something like the Seychelles or something like Chile, where we see cases spiral up again, and despite our vaccinations, we'll be back to seeing our hospitals overwhelmed, and unfortunately going into a 4th lockdown, which is the last thing I think anybody of us need, and I think would be a huge unforced error, because I think we've had the experience of what happens when we reopen too early after the 2nd lockdown, and we don't want to make that same mistake again. And so with that, I'll turn it over to questions.
All right, thank you, Dr. Hergy. Up first this week, we have Bonnie. 1 second, and I will unmute you, Bonnie. There you go.
Hi, everyone. Hope everyone had a great weekend. Dr. Hergy, I'm just wondering about the stay-at-home order. You mentioned that it's expiring pretty soon. What would be your recommendation to the province on the extension? Are you talking about early June, mid-June? When would you like to see it extended into?
Yeah, I think ultimately how far it goes really needs to be dictated by conditions on the ground. If I'm looking at some of those modeling results earlier, though, I'll just quickly pull it up here. Even in a very optimistic scenario of what we see with, where cases are, by the end of the month, we're still, close to 1,000 cases. We're somewhere between the yellow and green line. Will probably be maybe close to 1,500 cases. I still think that's pretty high. So I would think that we probably need to extend it for another month into mid-June, and then we can reassess as we get closer to that date. And of course, if things go well, cases come down more quickly than we realize, there's always the opportunity to pull that up earlier and end the stay-at-home order earlier. But my sense is that we probably need to go to mid-June to see cases come down to a pretty low level for our hospitals to really clear up. And by mid-June, I think we'd also be closer to about 75% of people being vaccinated, which is what the Public Health Agency of Canada has really articulated. And I think I showed that modeling a couple of weeks ago, where they've articulated that that's sort of the safe level of vaccination before we want to start to reopen. So my recommendation would be extend the stay-at-home order to mid-June.
And a follow-up, Bonnie?
Yes, thank you. When you're looking at community spread with the lockdown now, where are you seeing the cases continue to be spread? Is it still the social gatherings, the smaller group gatherings, or are you now seeing more of an emphasis on workplace spread?
Yeah, we're definitely seeing the small gatherings in homes still being an issue. We're seeing quite a bit of spread from that. But we are also increasingly seeing spread within workplaces. And I think part of that may be that with cases coming down, we're able to do better investigations around each of our cases, and we're maybe picking up some of the links in the workplace spread more. We definitely have quite a sizable number of our outbreaks are now workplace outbreaks, so we're definitely seeing quite a bit of spread in that context.
Thanks, Bonnie. Up next, I have CHCH with, I think is Jonathan, so you can unmute. Anyone from CHCH? Okay, we will move on. Paul Forsyth, you're up next. Give me 1 second here to find you on the list. And there you go.
Can you hear me?
Yep.
I can.
Thank you. Thanks, Meredith. Hi, Dr. Hergy and all. I just have two questions on behalf of a colleague who's writing an article related to long-term care homes and vaccinations. And the first question is, major outbreaks have declined at long-term care homes now that pretty much everyone has had their first shot at those homes. How can the larger population use that as an example to understand that vaccines work and that the more people who get vaccinated, the easier we get out of this pandemic?
Yeah, no, I think that's actually a really good example. That if you think about a long-term care home as sort of a microcosm community, we've vaccinated the residents with 2 doses of vaccine, and close to 100% of them have gotten 2 doses of vaccine. With staff and caregivers and family members who are visiting, they've only been vaccinated with 1 dose, and perhaps it's not complete amongst them. But with the residents, we've absolutely stopped seeing people being hospitalized when dying amongst that group. It's been very small numbers who've unfortunately become sick with COVID-19 and potentially passed away. And so I think it's a great example of how effective the vaccine has been at protecting that group. To the extent we're seeing any kinds of outbreaks and any kinds of spread in those homes, it's almost all been visitors or staff members, often who are not yet vaccinated, who are coming into the home and bringing an infection with them. And so that's showing that the threat remains largely actually from the people who have not yet been vaccinated. And so, the more we can get everybody to at least get 1 dose of vaccine, and once they're eligible for that second dose as well, we can make sure people are protected. We are going to basically starve off opportunity for infection to spread in our society, and it'll actually allow things to return to normal. And we saw the announcement last week where long-term care homes are going to be able to start to have more visitations with people once they have 2 doses of vaccine. People will be able to have the close physical contact with their loved ones again. And that's what we can look forward to as a society as a whole as we get vaccinations up.
And your follow-up, Paul?
Oh, yes, this is a bit broad. It might be too broad, but the recent long-term care commission report said nursing homes were neglected and the sector was unprepared for a pandemic and that the sector needs reform. What can the government and long-term care sector do to protect residents for the future, specifically in a pandemic, since we can't rely on vaccines being available when a pandemic arises?
Yeah, I would probably want to defer to the commission report and some other groups who studied this in much more detail, I think, to give a comprehensive answer of all the things that could be improved.
That's what I thought.
I'd say from our perspective in public health, there's a few things that really stood out from us. First off was just, I think, when infection got into the home, how vulnerable some of the residents there were. And so, making sure we, I think, go all out to provide protection in these homes, I think, is really critical. We saw over 70% of our deaths of COVID-19 occur in these homes. So really, I think we need to have a strong focus and priority on making sure we improve the sector. I think, the staffing of these homes was a particular risk for them, where if an outbreak started, a bunch of staff became ill, these homes really struggle to have sufficient staff then able to still come into the home to provide the care to everybody that needed care, to be able to practice all of the infection prevention control measures that are needed. So I really do think there needs to be more funding so these homes can be better staffed, and hopefully staffed with people who perhaps even have some higher level of training in infection prevention control. So we actually have the capacity there to manage outbreaks better. We have the bench strength that if infection starts to spread, a whole bunch of people need to be isolating, that the home is not super short-staffed and becomes super vulnerable as a result. And then one final thing that we saw is, a lot of long-term care home staff, while they're healthcare workers, they're often healthcare workers who are not well paid. Particularly, I think about PSWs who don't necessarily earn the same kind of incomes as physicians do or nurses do, and they have, in many cases, I think, are really struggling. We saw many PSWs would actually live together, so they might not actually be spreading infection at work where they're practicing all their infection control precautions, but they go home and their roommate or their two roommates would also be PSWs, and infection would spread amongst them and then spread back into the home. And so I think making sure particularly those segments I think are better paid would help make sure that they have maybe better quality of housing. They're less likely to be living in communal settings where infection could spread. And we saw with some of these workers, because they're living with fairly low incomes, often if they had mild symptoms of illness, they might still come to work. And I think that really reinforces why sick pay is something we've talked about as being so important, that people have the financial stability that if they are sick, they're not going to show up to work and potentially spread infection. They're going to be able to stay home and make sure that the safety of the residents in these homes stays foremost. And so those are the few things from the public health standpoint that I'd really emphasize. But I think the commission is going to have much more detailed and more comprehensive recommendations.
Thanks, Paul. Up next, we have Stephen Parr.
I have no questions at this time. Thanks.
Okay, thanks. Up next is Richard Harley. Go ahead.
Hey, everybody. Happy Mother's Day to all the mothers we have here. My question, I know you said it possibly mid-June would be your recommendation. What are the chances, maybe it's a hard question to ask, but what do you think the chances are that the province is going to listen to that? Is that similar recommendation coming from all public health units? And how often do they actually take that and listen to it and go by the recommendations?
Yeah, well, I can say it's, I think, absolutely the recommendation of almost every public health professional and probably every person within the hospital sector as well, who has really experienced on the ground the challenges of managing COVID-19. I think we're all recommending that the stay-at-home order be extended. I think the Ontario Science Tables data is basically arguing the same thing, that the stay-at-home order needs to be extended. Whether or if the province will listen, I think is a question better directed to political pundits who can, I think, predict what politicians might decide ultimately or not. I think all I can say is that based on the science, the recommendation is absolutely that we need to extend that stay-at-home order.
And a follow-up, Richard?
No, that's good, thanks.
Okay, great. Up next, we have Penny. Go ahead.
With the lifting of the stay-at-home order not too far away, if the province does decide to go with that date, have you been giving any thought to what you could do if it happens to be lifted? Anything more in the way of your Section 22s or anything that you would do for Niagara?
Yeah, so our Section 22 orders remain in place at this time. So if there was a reopening of dining or there was a reopening of retail and shopping malls, those orders remain in effect. So those provisions would continue. At this time, we haven't really thought of anything additional that we would do should that situation arise. It would certainly be something I think we might give some thought towards. We've really felt that our role at the local level is really to fine tune the broad provincial directions here. We locally can't institute a comprehensive lockdown on our society. That really needs to be done by the province. What we can do is then fine tune based on what we're seeing locally as some of the additional areas of risk and add some additional measures in those sorts of locations. So I think ultimately we would really be depending on the province making sure that they, extend that stay-at-home order. And particularly, if we were to act locally to do something, if our neighbors aren't in a stay-at-home order, people are going to travel around, and so it's not going to be very effective to just have something locally.
And a follow-up, Penny?
Nope, that's good, thank you.
Okay, great. And up next, we have Gord Howard. Go ahead, Gord.
Hi, just I know you list 29 outbreaks today. The Public Health Ontario website, and I know that sometimes can lag a little bit. It says that we've got 12 workplace outbreaks and 3 occurring in bars and restaurants. Are those all still small scale, or how big are some of those?
Yeah, the workplace outbreaks are overwhelmingly pretty small outbreaks. The bar restaurants, of course, they're not really doing indoor dining, so it would only be the handful of staff available, who are still working there to do takeout orders, who would potentially be infected. So you can imagine how that wouldn't be a very large number. Most of these outbreaks, I would say, all but maybe 2 or 3 are, under 6 or 7 people affected.
And a follow-up, Gord?
I think last week you said, as far as the number of adults vaccinated over 18, it was around 43.5% or whatever. What's the latest number on that as far as 18 and over? How many have been vaccinated?
Yeah, I believe it was 50.6% when I calculated it earlier.
Okay, great. We've gone through one round of questions. If anyone would like to ask another question, please let me know in the chat. Okay, Bonnie, I will unmute you 1 sec. There you go.
Thanks, Meredith. I'm sorry, this is my 3rd week asking the same question, but just, kind of thinking about the stay-at-home order being extended into June or maybe even mid-June. Has your position on the return to school picture, has that changed at all, Dr. Hirji?
Yeah, I think there could be a return to school before the stay-at-home order is over. I think the key condition we need before we reopen schools is that cases have come down sufficiently that when we have cases in schools, we have the capacity to really follow up with that case very quickly, figure out who's exposed and isolate them. I think to the extent we've seen success in keeping schools open through the fall and into December, and then for the few weeks that they reopened in February and March, the real key ingredient that made sure we didn't have big outbreaks in schools and had to see entire schools shut down was our ability to do really detailed contact tracing in the school, isolate those at risk, and make sure that who remained in school was able to be kept safe. I think where cases are right now, we're not going to have that capacity. So we do need cases to come down a little bit further. I'm thinking that perhaps even by the end of the month, we could be in a situation where we could reopen schools. So schools could perhaps, depending on what the number of cases look like, be at a stage where they could maybe start to return to school in-person learning on May 31st or so. And then we have the stay-at-home order remaining for the rest of society for, at least a couple more weeks. And I think that's also a good situation to be in, where if we reopen schools a little bit earlier, we have 2 or 3 weeks to see what does that do to our reproductive number, because we want to make sure that effective reproductive number doesn't pop back over 1. And opening schools first, seeing what that does, allows us to make sure that it doesn't actually cause that reproductive number to rise above. Otherwise, we would need to respond to that as well.
Okay, thanks, Bonnie. And over to Gord for one more question.
A lot of people I've talked to say they made it through the first year pretty well. I mean, as bad as it was, but they made it through pretty well. But that the 3rd wave is really getting to them. Are you really seeing a lot of evidence of that at Public Health?
Yeah, I don't know if I want to say we're seeing a lot of evidence. There's certainly some anecdotal evidence that, we see people are much less happy to isolate after this pandemic, after this wave, if they're identified as a case. We're seeing in our mobility data that we're not quite seeing as strong behavior in terms of people staying home or avoiding going out to public places. I would imagine that's again some signs of the pandemic fatigue and the difficulty of keeping up all of these efforts. That is somewhat anecdotal, so I don't want to necessarily, paint it as the general situation across Niagara. But I think, after 14 months, you can imagine people are becoming fatigued. I think we probably all are as well, and it's becoming harder and harder to maintain this. And I think that's another reason why it's so important that we stick out the stay-at-home order for a little bit longer and really get our cases to a level that's sustainable. Because if we do see cases rebound, we do have a fourth wave, I don't know how well we would do with that fourth wave. If we're able to get our cases down, reopen when cases are low and vaccinations are high, it can be a really sustainable reopening. Everybody can finally get that relief they want. And it won't be reopening for a few weeks and then going back into a shutdown. It'll actually be a reopening where we can stay open.
Okay, thanks everyone. Thanks for joining us this week. We'll see you next week. In the meantime, if you have any additional questions, please email Courtney or me, and we will do our best to get them answered by Dr. Hergy. Thanks.